Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Ravi Dosi. And today we have moved to, sometimes we feel bad when we are actually taking away time from doctors and their patients. And Dr. Dosi was just with a patient right now. In fact, we didn't really have a conversation which we normally have with doctors before the session. So welcome to Health Live at Seniors Today, Dr. Dosi. Today before I introduce him, today we are going to be talking about a very important topic for seniors, which is sleeping soundly in your senior years, understanding age-related sleep changes. And let me introduce Dr. Dosi to you. Dr. Dosi is a senior consultant at the Kokilaben Dhirubhai Ambani Hospital in Indore. So this is our first, Dr. Dosi, you are our first doctor from Indore, from the land of Chappan, and amazing food that you get there. I've been there a couple of times, and just amazing place. It's it's called a mini Mumbai, but I can tell you it's much cleaner than Mumbai. So about Dr. Dosi, his areas of interest are tuberculosis, interventional pulmonology, sleep medicine, COPD, and asthma. He has performed various procedures like IPD consultation, chronic respiratory management, flexible and rigid bronchoscopy, pigtail placement, pleural tapping, etc. He is an MBBS from MGM College Indore. He has a diploma in tuberculosis and chest diseases. He has a DNB in respiratory diseases from Hyderabad. He is a registered polysomnographic, and he has a diploma in pediatric sleep medicine, a postdoctoral diploma in interventional pulmonology, a postgraduate diploma in clinical research, a fundamental clinical research support course, and an advanced cardiac life support course. He has also done a fellowship of the United Academy of Pulmonary Academy. He has a fellowship in allergy, asthma, and immunotherapy. He has a fellowship in sleep medicine from the Safdarjung Hospital in New Delhi, and a fellowship in interventional pulmonology and EBUS from the Amrita Institute of Kochi. He has over 15 years of experience. He has been in the field of chest medicine since 2005, and actually, so it's just more than 15 years. He's been assistant professor of Department of Respiratory Diseases at the Aurobindo Institute in Indore. He has been professor and head of the Department of Respiratory Diseases, also in the same college, and a host of other things that he has been done in the past. If I were to read out his CV, it could be take away this entire session. But he's had he's been very active in the COVID pandemic protocols, and he has been very actively involved with the government of India. Thank you and welcome to Health Live at Seniors Today, Dr. Ravi Dosi. How are you?
Thank you, sir. Thank you, sir. It's an absolute pleasure to be here. Thank you for that very kind introduction. And I feel so wonderful that, I have a lot of Mumbaikars along with me, and me from Indore is going to talk to all of you. Really feeling glad.
Doctor, we have, as we speak, around 146 people who have registered, who are online here, and perhaps over 500 odd in the YouTube channel. So over to you, Doctor. Before As always, Dr. Ravi Dosi will be making a presentation first, which will be around for 10-15 minutes. And don't worry, this presentation is being recorded and it will be up on the Seniors Today website on Monday evening. So you can go through it. Please put down your question in the chat box after the presentation is over, after you've seen the entire presentation. And do remember that sessions like these are advisory in nature. And in case you do have any specific query, you must visit a doctor in your city or wherever and consult them. Of course, Dr. Ravi Dosi and our various doctors who come on our show are also available for a teleconsult. Over to you, Dr. Dosi.
And I would like to extend a big thanks to the organizers of today's web meeting. And it's a great opportunity for us to interact and talk about sleep medicine. I think like Pradyuman sir elaborated quite a lot of what I have been doing, what I do, what I have been qualified and trained in. One very important aspect of chest medicine or respiratory medicine. मैं basically सांसों का डॉक्टर, तो इन सांसों में आजकल एक बहुत ज्यादा इंपॉर्टेंट चीज इंक्लूड हो गई है, एंड दैट इंक्लूड्स स्लीप मेडिसिन. So today's emphasis of my lecture will be on how changes happen with aging and what are the different challenges that elderly face while they are trying to get a good night's sleep. My presentation, I tried to keep it very non-technical since I could explain my things more, but it will be having some technical terminology because that is only how we can convey the science to anybody in a very proper and correct way. स्लीप मेडिसिन वेरी सिंपली पुट, एट टाइम्स पीपल बोलते हैं कि ये खराटा है, खराटे वाली जो बीमारियां होती हैं उनको स्लीप मेडिसिन कहते हैं, सिर्फ खराटा लेना एक नींद की समस्या है, बट इट्स नॉट एज apparently simple as that. Snoring is one sort of a sleep related issue, but it is not the absolute sleep related issue, and snoring in every case is not a disease. Snoring कई तरह की होती है. It can be a very innocent primary levels go down, a lot of stress comes on your brain and your heart, the result of which is that you end up having multiple multi-system problems developing. So see, sleep is one such thing which is very, very highly personalized, very highly dear to all of us. All of us sleep at a fixed time, or we should sleep at a fixed time. We should try to sleep at a fixed place, and we should try to sleep in the most comfortable of environments as possible. So I would begin with my presentation, but I'm already telling that I won't be trying to get very technical. Some points are technical, but I'll try to see how I can explain them in the most simple of ways so that we can have an effective discussion later. So I hope my screen is visible to you. I would like to reintroduce myself. I am Dr. Ravi Ashok Dosi. I am currently working at Kokila Dhirubhai Ambani Hospital, Indore branch or Indore unit, and I am working in the chest medicine department where we also deal with sleep diseases. So today my topic of discussion is sleep disorders or sleep related issues in the elderly. How do we catch them and how do we manage them? So I would be trying to cover a lot of the common things which we face in the elderly. The most important of those problems is insomnia or lack of sleep. Now, how insomnia can be a disease or how it can be just a normal part of aging, that I would like to try to discuss with you. Insomnia is a sleep disorder. While many people say ki sleep, snoring, feeling very sleepy, feeling tired all the time might be the sleep disorder, but you would be surprised to know that the most common sleep disorder which is prevalent in the world is insomnia, and as high as 50 to 55% of the world's population at some point of time in their life suffers from insomnia. Hello. Okay, मैं बाद में बात करता हूँ आपसे. So, sorry for the interruption. Sleep disturbances are very common in adults. By adults, I would like to make it a generalized term. That means anybody who is above the age of 18 is suffering from sleep disturbances. More so, as we age, our natural sleep hours tend to go down. So we tend to have more sleep disturbances. And as adults, we are more associated with several addictions or habits like caffeine, tobacco, alcohol. Our sleep times change as per our jobs and opportunities. We also have to do shift work, and as we age, at young age or at an elderly age, we tend to get more diseases. These sleep disturbances are very common in India. The most common sleep disorder of them all is insomnia, where a person finds difficulty in going to sleep or maintaining his sleep or getting up early in the morning afresh. What is important is that elderly people are more likely to have some other diseases along with this problem. So they often say, "Ki, I have a bad back, I have a bad throat, I have some chest pain, and that is the reason that I don't sleep." But it's not like that. Insomnia in itself is an independent problem, and often because of that also we might develop problems. So it is very important that we recognize this insomnia because it has a impact on what we do in the whole day and how the quality of our overall life is. So the important essence of my point, my statement over here is that in order to have a very good tomorrow, you need to sleep well today. And in that sleep, if you're not able to sleep properly, you could be suffering from insomnia. Insomnia, basically we try to understand in three factors. They can be genetic factors, they can be related to stress, or they can be environmental factors in which there may be several psychological stresses like life events which go on, or there can be several perpetuating factors like behavioral, psychological, environmental, or physiological factors. So it is the combination of these three P's, the predisposing, precipitating, and perpetuating, which actually make you an insomniac. These factors come and go in several forms in all of our lives on a daily basis. Some of us know how to deal with it effectively, but some of us are unable to deal with it effectively. So we need to understand that humanity or evolution has made several systems in our brain. The two important of which are the circadian system and the homeostatic system. This might sound a lot of technical jargon to you, but it is the basic interplay of these two systems, which one system, the homeostatic system, makes you sleep, whereas the circadian system tries to keep you awake. And it is the interplay of these two systems which is actually making us go about our whole routine. It determines that we get up in the daytime and we sleep at the night time. Melatonin is that particular hormone which is responsible for the circadian system, and we have a place in the brain which is called the suprachiasmatic nucleus, which gets your stimulus from the eyes, and that is how we get up in the morning. And as the stimulus goes down in the whole day, we tend to go asleep at night. As in as humanity is evolving, at night we are having more of lights. So while our ancestors used to sleep in caves over millions of years, but over the past 200 years, whole of the humanity tends to stay awake at night because now there is such a lot of electricity and light going on. So as compared to million of years, our brain has just had 200 years to readjust. And every time this readjustment doesn't happen very comfortably or coolly, and the result is many of us are now started to realize that we are getting fatigued or we are dipping inertia, and our sleep is actually going bad, causing a lot of problems like heart problems and brain problems to crop up early. Our sleep is of various types, non-REM and REM, and this aging actually decreases your sleep uh, overall quantity. There are several aspects of sleep which we look into, like the total sleep time, sleep efficiency, the type of sleep. Your sleep is actually made up of two different types of components. One is REM and one is non-REM. Several components of non-REM further are there, and
Gosh, I think doctor's connection is slightly weak. He's back.
Am I audible now, sir?
Yes, you're audible.
Yeah. So this aging reduces or these systems, it causes a changes in your sleep architecture and how we sleep, how our body responds to several immune and other immune related issues. All of these are altered with as we age via our sleep. Now, in order to diagnose any person as having a sleep disorder, whether that person is insomniac or not, we need to understand that this problem has to persist for some time. What I want to say is that problem can be acute, problem can be chronic. If somebody is having a sudden stress, like somebody has a breakup in the relationship or somebody has a financial crisis which has just come, then you might feel that हमारी रातों की नींद उड़ गई suddenly. That is not a sleep disorder. That is an acute stress response to some happening in the body. That will be termed as acute insomnia. But if the same problem persists for 3 months or more, then that converts into a chronic insomnia. And that is where the problem becomes really big and we need to address it importantly. Another symptom is that when inadequate sleeping causes a lot of tiredness, you are not getting adequate rest throughout your day. So the result is that the whole day you are feeling weak. Mentally, you are not able to perform fully. Either you become irritable or you tend to become lazy. So overall, your efficiency and quality decreases. People tend to consider you more lazy or conservative. And in today's aggressive professional world, this sort of behavior can actually cause a lot of problems in your job and family life. So, insomnia in the elderly often report sleep maintenance issues or early awakening. That means they tend to go to bed early and get up early. And at times, what they say is कि हमको नींद तो आ जाती है, but we are not able to sleep throughout the whole night. So this is basically a sort of readjustment in their sleep physiology. They tend to go to bed early, and they might even be going to bed as early as 6:30 to 7:30 p.m. And the end result is they have a 4 to 5 hour sleep cycle. They get up at night 2 o'clock or 3 o'clock when everybody is sleeping. So this causes a huge imbalance. They can't go back to sleep. They will try to sleep, but they don't get any sleep, and the whole result is that their social fiber becomes very, very abnormal. With this continuous insomnia and sleep fragmentation, they develop cognitive and functional impairments. There becomes an imbalance which happens. It is shown by several studies that shorter sleep duration, reduced sleep efficiency, and increased arousal in old adults affects your life quality, and it is associated with cardiovascular risks and depression. Now, this is a proven fact scientifically also. So, we need to understand that insomnia is no joke. It can be the actual reason of all the heart attacks and all of the mental problems and metabolic problems that we are having. So, how do we assess it? What we do is we use simple pattern recognition systems. We will give you a sleep diary. We will give you a watch. We will try to measure how you are sleeping on your whole 2 weeks. We will talk to you and try to assess your medical, psychiatric, and environmental factors. We will screen you for several medical conditions, particularly those which cause pain. And then we go to the treatment part of that. Always we tried some non-pharmacological approaches in which the most important therapy is having a good sleep hygiene. Now you might say, what is a sleep hygiene? Well, sleep hygiene is doing regular exercise, eating proper meals, having a comfortable sleep in a good environment, and most importantly, avoid of stimulants like caffeine, alcohol, and nicotine. Behavioral therapy is given for the treatment of insomnia, in which we try to control the way that you spend time on the bed. We'll allow you to go to bed only when you are about to sleep. We don't allow you to go to bed to read a book or to watch mobile. We absolutely don't want you to take any mobile device to the bed. That is not proper for you. Then we go to something which we really, and not only me, most of the people want to avoid, that is taking sleeping medicines, which we call as hypnotics. So there is a whole area of sleeping medicines going on. There are the old generation ones which are habit forming, but there are the new generation ones also which are very short acting and non-habit forming. So at times when the lack of sleep is there, we even have to give that in our elderly patients. we need to remember that neend nahi aana is not the only sleep problem. There are some other problems also, like some people behave very strangely in sleep. They tend to have nightmares, they tend to sleepwalk, they tend to barbadao in sleep a lot, they tend to groan in sleep. At times, we have sleep partners coming to us ki my sleep partner kicks me a lot in the night time. So all of these things come under the gamut of sleep medicine, and we need to have several methods to diagnose these problems. Like we do polysomnography, which is commonly called as sleep study, and by the basis of this, we make a diagnosis and treat you for that particular problem. There is one very common problem. You might have seen that there are some people who get very restless and they tend to move their legs quite a lot. They tend to itch, they tend to become very fidgety if you don't allow them to move their legs. Well, that also is a sleep related disorder called as restless leg syndrome. So it's very interesting when you look at the sleep medicine, from insomnia means neend nahi aana to OSA means loud snoring to hypersomnia means we have people who are sleeping up to 11 hours a day. All of these come under sleep medicine, and elderly patients usually commonly present with insomnia. They commonly present with obstructive sleep apnea, restless leg syndrome. Sleep apnea syndrome is the most common form of the thing which you hear about, which is snoring. Whenever you go to any new place, or you are traveling by train, or you're going to any XYZ place, you find that somebody is snoring very loudly. And not only that, you have pity for that person, but the surrounding people also are feeling कि यार हम सोए कैसे, this guy snoring is not letting us sleep. Well, snoring is commonly associated with metabolic syndromes, diabetes, hypertension, and cardiovascular events. And nowadays, we, apart from that very famous machine for preventing snoring, which is called as a CPAP machine, nowadays we have something more. We can offer you medicines, we can offer you surgery, and we can even give you some trendy and swanky oral appliances which are custom made for you so that you can not snore. So neither does your partner get irritated, and even you have a better quality sleep. So, in conclusion, I would just like to say that sleep medicine is actually life in itself. It's a comprehensive medicine. Any person who is not having a good quality sleep of 6 to 8 hours at any age needs to understand that sleep is important. Sleep hygiene is important. And if you are having problems like we discussed, like insomnia, loud snoring, irritating others, your partner, or if you're having abnormal movements at night, or if you're moving your legs a lot at night and causing hurt to your partner or yourself, then definitely you should visit a sleep physician and you should try to get yourself evaluated for that sleep disorder. Now, I think we'll take up the rest of it in the discussion. Back to you, Pradyuman.
Right. Thank you very much. Thank you very much, Doctor. I think very detailed presentation, and I think a fair number of questions are answered, but some of the questions are maybe repeat, but we have, I'll just give you a flavor of the kind of questions people have. This is from Mukta Garg. She says, I have very less sleep, tired or not, but less and light sleep. I think you have answered this question, but is there anything else that she can do? Is there any exercise that you recommend? You know, there are some people who say that it is a good idea to do your exercise, do your gym workouts, etc. in the evening so the body is tired. Is that something that you would recommend?
Actually, we are correct, sir. We should exercise 1 or 2 hours prior to sleep. We should not never exercise just prior to sleep, because once you start exercising, your sympathetic system or the stress system gets activated. So actually, you tend to delay your sleep. You will get your sleep late, and later. So you should always exercise lightly in the evening, and that too you should give yourselves 1 or 2 hours time prior to sleep, gap between your exercise and sleep.
Right. We have a question from Mr. Jambunathan. He says he's 76. He's from Bangalore. He says, I'm having the Oribcan for dry mouth during the day as well as in the night. I do not have any sleep apnea. Is there a problem of dry mouth and sleep? Is there some
It's when dry mouth is a common problem faced by several people at night and when they get up in the day also. Commonly, this problem is related to snoring and people who suffer from sleep apnea. The what I told the SAS syndrome or the OSA syndrome, they commonly tend to have this dry mouth problem. So we take it as one of the important indicators that if somebody is snoring a lot and is having dry mouth, then definitely that person should undergo a sleep study and we should see if his snoring is faulty.
Doctor, the question from Sharda Parvale, who's asking, it's a very direct question. Is insomnia dangerous?
Well, it is dangerous. I would just like to quote an experiment with mice. Well, they made mice not sleep for only 3 days, and the fourth day, most of the mice in the bin passed off. So humans, our brains are more complex. So you might feel that we might manage with very little sleep or no sleep also, but the amount of stress it gives to your body is immense, and if you don't sleep, it is actually considered to be as dangerous as asphyxiating yourself. So, insomnia is a very dangerous problem. It causes a lot of stress on you, on your thinking, on your body, on the overall behavior that you have with your family and society. So, if you have insomnia for a long time, definitely reach out to the correct person and get it corrected.
This is from Hina Mehta. She says, sleep break होती है 2-3 घंटे नहीं आती. This is something that you've mentioned, but
See, sleep nahi आना is sleep onset problem. Why sleep is not coming? क्या हमारी habits की वजह से है या फिर हमारे को कोई disease है? That is important. Mostly out of 10, 88 people will be having habit related issues. It won't be a disease as such. So we just need to improve our habits, which I refer to as sleep hygiene. Sleep in a proper place, sleep in a place which is comfortable for you. And then the second part, that sleep break होती है, तो it breaks most oftenly if you will ask around कि रात को हमको 2-3 बार यूरिन के लिए उठना पड़ता है. That is the most common reason कि लोगों के sleep break होती है. तो now this is a problem. Sleep problem से भी sleep break होती है और sleep जो इश्यूज होते हैं उनमें कच्ची स्लीप होती है. इवन विथ एजिंग और सपोज इफ यू हैव हैड अ सम स्ट्रेसफुल डे, देन आल्सो देयर इज अ चांस दैट योर स्लीप में ब्रेक. So sleep breaking, if it becomes a habit for you, it is an indicator of sleep disease and it should be evaluated. But if it is happening acutely for some time कि कुछ event हुआ है और ये हो गया है, then it should get solved in 7 days or more, or otherwise we should get it evaluated.
there's a question from Sunita Verma. What causes restless legs?
The important reason of restless legs is sleep apnea. Basically, when you snore quite a lot and oxygen levels go down, or when you have a lot of iron deficiency in your body. These two common reasons are seen in restless leg. Importantly, so we need to identify whether the person's snoring is excessive. That is when we need to work on it.
There's a question from somebody, doctor. When I'm in a moving car, in a closed moving car, which is air conditioned, I yawn several times. Is it also a case of sleep apnea, or I could get sleep apnea in a few months or years from now?
Well, yawning definitely is an indicator that your brain needs some rest or your mind is getting fatigued, but it in no way is an indicator of sleep apnea. By sleep apnea, you will actually go to sleep, forget yawning. And it commonly happens that when you are watching your favorite television program, you are in the traffic, you are reading a newspaper, you will see people who just doze off. That is what is the problem. Simply yawning is not considered as a symptom of any sleep disorder. But yes, if you're yawning frequently, that shows that you're fatigued and that the quality of your sleep or the duration of your sleep is not proper. So you need to work on that so that you don't yawn at the wrong time.
Thank you. We have a question from Anupama Singh. What is pink noise for sleep?
Yeah, I really have to look that up and I'll share with you. I don't have any idea about pink noise.
This is a question from Mr. Rajendra Shah. He says, on one day, I'm not able to sleep the whole night, but on another day, I'm able to sleep very nicely. And he is 64.
I wouldn't call that as a disease up till now, because that is a very common issue. At times, there may be many variables attached which are not being described here. For example, Mr. Verma might be seeing an IPL match on one day, and the next day he might be seeing a simple movie which he doesn't like. So, or there can be some sort of social events going on accordingly as any stressor events. So, generally, we should try to always sleep at the same time, same place, so that our sleep quality is maintained. But somehow there may be factors which might be affecting it. Don't consider yourself as disease prone just because some changes are happening. But if this is happening for a very long time, let's say it's happening on a regular basis, then we should work it up and see how we can help you.
Right. Now, this is a question from Anita, who says, I don't get sleep during my train journeys, and sleeping pills are not available without medical prescription. What is the solution?
Well, it's a very common problem. A lot of people are not able to sleep away from their own bed, forgetting journeys. When people don't have their own bedroom, their own bed, they are not able to get a good quality sleep. When you're in a journey, you're in a situation where you're supposed to be alert all the time. It can be a late night arrival at the station. It can be an uncomfortable surrounding. It can be the air conditioning of the AC compartment. There can be multiple factors which might be affecting externally your brain, so you might not be able to go into sleep. So not being able to sleep in a journey, anyway, if you're going on a journey, we should definitely avoid taking sleeping pills while we are in a journey, until unless you are going transatlantic or trans-Pacific, when jet lag may happen, so you have to sleep accordingly. But in journeys, sleeping pills should not be taken. You can take some medicine for your vomiting or giddiness. If you are having such problems, then it would be much better to consult a doctor, understand what is the problem, and take a medication accordingly.
Right. So this is a question from Shashi Gulati. ड्रीम्स बहुत आने को कैसे रोक सकते हैं? बिकॉज इसकी वजह से स्लीप ब्रेक होती है.
वेल सी सपने कभी भी आपकी नींद को ब्रेक नहीं करते हैं. आप नींद की गहराइयों में जाते हैं तब सपने आते हैं. यू कैन ओनली ड्रीम व्हेन यू आर एंटरिंग द रेम स्लीप, एंड रेम स्लीप विल ओनली कम व्हेन यू हैव हैड अ गुड 100 minutes ऑफ सॉलिड स्लीप. सो डोंट थिंक कि सपने ज्यादा आने से हमारी नींद खराब होती है. इट नेवर हैपेंस लाइक दैट. In fact, if you are getting dreams, then you should be happy that you have been able to touch to the deepest realms of sleep which there are.
Right. This is a question, another question from Anupama saying, what is the correct posture for sleep?
Well, some people say that sleeping in the right lateral position is good for your digestion and heart. Some people say sleeping in the left is good for your lungs. And some people say sleeping supine is best. But very practically, what has been given, documented in books is sometimes you sleep right, sometimes you sleep left. Don't make a habit of sleeping in one position all the time, because both positions have been shown to have medical benefits in their own way.
Right. This is a question from Mr. Stephen Narayan. Mr. Stephen Narayanan says, I go to sleep quite late, usually around 11:30 p.m. And my pet cat Garfield wakes me up at 3:30 a.m. for feed, and again at around 5 a.m. Finally, I'm up at 6:30 p.m. This is becoming a pattern. Is it sufficient sleep?
At least your pet Garfield is getting good sleep, that much I can assure you. And so Garfield is known to sleep all the time in the famous cartoon also. Well, I will tell you one thing, sir, that first of all, waking up repeatedly at night by your pet or your family person is not a good habit. You should train your kitten to not disturb you at night, or somehow manage things in such a way you provide extra feed to your kitten that it doesn't disturb you. It also shows that your sleep is quite, what do you say, kachi neend. It gets very easily disturbed. So this pattern of your cat disturbing you is leading to a term called as insufficient sleep syndrome. Means you don't have any sleep problem, but because of insufficient sleep, you are going to develop sleep related issues. So it is very important that you manage your kitten's feed in some way that it stops troubling you. Nahi to definitely 1 or 2 months down the line, your blood pressure and other things will start getting deranged.
Right. Doctor, two more questions. We have one from Bomi. Doctor, should we not drink water before bed, as this causes us to urinate 2 or 3 times every night? Is there some kind of an advice on that?
We should drink a glass of water before we go to bed. There is no harm in it. Anyway, you will be urinating if you have to urinate, even if you don't drink water. The only thing is, we are not supposed, see, there should be a gap of 4 hours in between your last consumption, be it liquid, solid, and your sleep. In between that, if you're having a dry mouth, there is no harm in drinking water. A glass of water won't harm you in any way at all.
4 hours is what you are talking about. So which means if a person wants to sleep at 10, you should have your meal at 6 o'clock.
Yes, sir. In the evening, our stomach, our intestines, they all start working very slowly. So, as and as we have a smaller gap in between our dinner and our sleep, a lot of food remains indigested or partially digested. That causes more acidity, bowel problems, abdominal pain, and irritation in the morning as compared to when you have a 4 hour gap. That is why it is always considered good to have your dinner light and early and try to sleep 4 hours after your dinner time.
Right. Doctor, one more question. This is from Mr. Vinay Srivastav, who says when there are some worries, it becomes difficult to sleep at night. Uh, Doctor, does this happen to you as well? And what do you do to sleep?
Sir, everybody has worries. This is a world full of stress, and stress to free mein mil jata hai. You don't need to take ask for it or pay for it. But the important thing is your sleep routine should be very correct. Try to read a calming book. Listen to calming music. Be surrounded by simple light perfume of natural flowers when you're trying to go to sleep. Your bedroom should be the most isolated and comfortable place of it all, where there should be no mobiles, no laptops, no iPads or anything with you. That is very important. Everybody is having worries of some nature or the other, but we should try to divert our mind just prior to sleep by reading books which give us good thoughts. We should definitely try to avoid social media platforms 1 hour prior to sleep when we are worried, because you tend to take in more of negativity when you are worried rather than when you are happy. I think there is some sort of a psychological connection in between social media and worrying. So these are some simple ways that you can use so that you can save yourself from not getting any sleep. And some other methods are, like sir told in his first question, you can opt for some light exercise, go for some light walk prior to your sleep so that you get physically tired and get sleep early. Important thing is, howsoever stressed you may be, let the world be ending tomorrow. You are going to sleep at 10 means you are going to sleep at 10. You go to your bed at 10. Try to go to sleep. If the sleep doesn't come, no need to get out of bed. Try to get sleep by reading a book. Don't switch on your mobile.
Right. Thank you very much, Doctor. There are quite a few questions that are coming in. Can I take one more question? This is
Yes.
from Marjorie Fernandez. I have undergone a sleep study which found no sleep apnea. However, it is years since I have been able to sleep continuously for more than 4 hours at a stretch, no matter when I go to sleep. I'm unable to get sleep after I wake up. Then I feel sleepy and tired the whole day and can fall asleep for short periods even when I'm sitting. I avoid taking sleeping tablets. What can I do?
Sir, Ms. Fernandez seriously needs to come to Indore and visit me once, sir, because I feel that we need to sit down and talk with her. The routine that she's telling that she is unable to sleep, there has to be some reason to it. Evolution has made us all humans in such a way that we are bound to get some amount of sleep or the other. If we are not able to sleep, there is to be some scientific reason behind it. Once we find that reason, I am sure people like Ms. Fernandez and others will get their due quota of sleep very adequately.
Doctor, there's one more question which is there and which I have had in my mind in the past is if you do have a sleep problem, do you go to a respiratory physician, a pulmonologist, or do you go to a sleep medicine doctor? And are there enough sleep medicine specialists in the country?
Sleep medicine is such a special medicine which includes chest people, it includes general physicians, it includes neurologists, it includes ENT specialists, it includes dental specialists, and nowadays even general physicians are entering into sleep medicine. Any doctor who has been trained properly in sleep medicine or who can at least recognize the symptoms, you should visit that particular doctor. And I am sure that doctor, on the basis of your diagnosis, will guide you further as to which specialization will help you the most. because there are many reasons of not having a good sleep. Most reasons are related to the respiratory system. That is why chest people do sleep medicine and sleep work quite a lot. But all the specialties that I mentioned can help you. So whomsoever is nearby, the important thing which we want to convey, me and Pradyuman sir both, is कि if you have a problem in your sleep, go to a doctor. Don't try to solve it with some, any do-it-yourself tricks.
Right. Doctor, I was going to take this as the last question, but there's somebody who's just requested, please take my question, and I don't want to deny it to him. This is from Mr. Viswanathan Subramanian. He says, when I sleep on my back, sometimes there's a momentary breathlessness, and I wake up gasping for breath. Should I keep my head raised by an extra pillow?
When you are sleeping flat and you're not able to sleep, that is an indicator of either underlying heart issues, lung issues, or there can be some obstruction in your airways because of sleep apnea. What I would suggest, Mr. Vishwanathan, is to go and visit a doctor of your specialty available nearby. They will assess your airway and your heart and lungs, and they will give you a solution to it. This is not a thing which should be taken lightly.
Thank you very much. I know there are some people who have asked, Marjorie Fernandez has asked, who can I consult in Delhi? Ms. Fernandez, I'm sure there are very good doctors and very good medical facilities in Delhi. You should perhaps speak to your physician, and she or he would be able to guide you. Thank you very much, Dr. Ravi Doshi, for being here. Thank you very much to the Kokilaben Dhirubhai Ambani administration for facilitating this. And we will be back again next Saturday. In fact, next Saturday, we have a special session. This has been, so before that, just after this, I'm going to also request our producer Firoz to play the video of this current issue. We have a special session by Dr. Rajiva Gupta. He has written the cover story in this issue of Seniors Today, and which is on fatigue. And he has written a book also on fatigue and stress. And I must just announce here that the 10 best questions which will be asked next week, we will send you a copy of Dr. Gupta's book. So with that announcement, can I just request our producer to play the video? Dr. Doshi, you must have a look at our magazine. This is the March 2025 issue of Seniors Today magazine. Right, so this is the Seniors Today issue of this month. Go have a look at it, download it from our website, or subscribe to our newsletter, so you will also get a copy of the magazine. And do remember that we have the Evergreen Club, which has over 20 events every day, 20 events through the week rather, and morning, afternoon, and evening. So download that and enjoy. Most everything is free of cost, and there are no conditions applying. So thank you, Dr. Doshi, for being here. And we will send you a copy of the magazine as well, so you can have a look at it. And I'm sure you will enjoy the magazine and the service